Hello, my name is Akil Sood. I'm a second-year internal medicine resident at UTMB in Galveston, Texas. My presentation is on a case of reactive arthritis following murine typhus. So we have a 56-year-old male with a past medical history of HIV on antiretroviral therapy who presents with a 1-week history of watery diarrhea. He also reports having fever, cough, and body aches, and he has a rash on his abdomen and lower extremities. He denies recent antibiotic use or recent travel. Of note, he has a pet cat at home. On admission, he's febrile with a temperature of 38.2, tachycardic with a heart rate of 110 beats per minute. The rest of vital signs are stable. On exam, he's noted to have a papular rash over his abdomen and lower extremities. And on abdominal exam, he's known to have diffuse abdominal tenderness. No peritoneal signs are present. The initial lab showed a platelet count of 52,000. He had a sodium of 128. He had elevated ALT and AST at 162 and 121. His alkaline phosphatase was within normal limits. An extensive infectious workup was performed, which showed no growth on blood cultures. Respiratory panel was negative for RSV, influenza, and Legionella, and stool studies were negative for growth for the bugs below, including C. diff. Given his clinical symptoms and lab findings, there was a high suspicion for typhus fever, so the patient was treated empirically with doxycycline. His symptoms did improve, however, the fevers persisted. 3 days later, the patient developed sudden onset right eye pain and redness, and he also noted bilateral knee swelling and tenderness. And here is a slit light eye exam which showed flare and cells suggestive of anterior uveitis. And given the seronegative arthritis and uveitis preceded by a GI infection, the diagnosis of reactive arthritis was made. The patient was treated with NSAIDs and steroid eye drops. He was noted to have significant improvement in his symptoms. The initial serologies were negative for Rickettsia typhi. However, they later returned positive, confirming the diagnosis of murine typhus. To date, there are no reported cases of reactive arthritis due to murine typhus. And just a little bit about murine typhus, it is a flea-borne infection caused by Rickettsia typhi. Rodents, fleas, opossums, and cats, as seen in our case, are reservoirs of infection. The typical features include fevers, headache, and maculopapular rash. And thrombocytopenia and elevated transaminases are clues to diagnosis. In recent years, there has been an increase in the number of cases of murine typhus in Galveston County. This case highlights awareness of Rickettsia typhi as a cause of acute febrile illness in the Galveston area.